What does informed consent for tricyclic antidepressants, otherwise known as TCAs, look like? This is medications like clomipramine, amitriptyline, nortriptyline, doxepin, and others. My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, and these are the tricyclic antidepressants. So these act kind of similarly to the SNRIs in that they are selectively inhibiting the reuptake of both serotonin and norepinephrine. However, unlike the SNRIs, they are much less selective, meaning that they have a lot of activity on a lot of different neurotransmitters and receptors. So that includes things like NMDA, histamine, muscarinic acetylcholine, dopamine, alpha-adrenergic receptors, as well as sodium and calcium channels. So all this to say that they have a lot more potential indications, and they also have, in some cases, a lot more potential side effects. But before we jump into the side effects, there's two kinds. There's the secondary amines and the tertiary amines. So the secondary amines are primarily targeting norepinephrine, and they're going to have fewer side effects, whereas the tertiary amines are targeting both norepinephrine and serotonin, and they tend to have more side effects. So the most common uses in psychiatry are going to be for things like depression, anxiety, insomnia, in some cases OCD. Somatic indications include things like chronic pain disorders like diabetic neuropathy or fibromyalgia, as well as migraine prevention, irritable bowel syndrome, and nocturnal enuresis, meaning bedwetting. So let's jump into the side effects. So there's going to be the anticholinergic side effects, which are things like dry mouth, dry eyes, urinary issues, constipation, blurred vision, increased sweating. There can also be issues like dizziness, headache, tremors, orthostatic hypotension, which is when you stand up really quickly and your blood pressure drops, headache, tachycardia, palpitations, increased appetite and weight gain, sexual side effects, as well as emotional blunting. Now, because of the TCA's activity on those sodium and calcium channels, there are more potential cardiac effects. And so if you have any cardiac issues or you're having a history of palpitations, it's important to get an EKG and to talk to your providers to make sure that there's nothing going on there. Also, for this reason, these medications can be really dangerous in overdose because they can lead to dangerous arrhythmias. Other potential adverse effects include, of course, the risk of suicidal ideation. There is still a black box warning on these medications for that reason. There can be increased risk of bleeding. There can be serotonin syndrome, especially when used in conjunction with other serotonergic agents. Sometimes they can trigger mania, and many of them decrease the seizure threshold, meaning there's an increased risk of having a seizure. There's also the risk of acute angle closure glaucoma in those who have a narrow anatomical angle. And of course, when it comes to withdrawal effects, there's the risk of acute withdrawal as well as protracted withdrawal. And although in most people, those sexual side effects that might happen will resolve upon discontinuation of the treatment, of course, there are going to be cases in which this can persist. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.